channel. This is Shweta here with the Vibing Souls, and just like my channel name, I hope you all are vibing positively out there. So today's topic is my journey of removal of wisdom tooth for the past 2 weeks. I know the topic seems very simple and kind of funny, but this needs to be discussed, this needs to be talked about, because the postpartum effects of removal of a wisdom tooth isn't it that easy until unless you face the situation. So I have been facing this situation for the past 2 years. This has happened to me twice, and just 2 weeks back I have gone through the same thing. So I would like to discuss the same with you. I would like to start off with the video as beginning from why it needs to be removed, how is it grown, what are the medications, what are the food that needs to be intake, what are the precautions, what are the effects, etc, etc. So let's get started. So yes guys, here I have my x-ray with me so that I could show you what exactly transpired with my tooth. Before that, let me tell you what is a wisdom tooth, when it is grown, at what age, and what are its causes, why is it grown in an improper manner. So yes, the first one is, what is a molar tooth? It's a synonym of a wisdom tooth. So yes, it's called as a third molar tooth also, which is usually grown after the age of 18 or 19. It depends on every individual. And why it is grown improperly is because one of the main reasons is due to your heredity or due to your genes. So I got to know via my father that he also had an improper growth of molar tooth, like on both the sides, left and right. And then I got to know, yes, he is one of the main reasons as to why I'm going through this suffering. So yes, let me show you from where I got my x-ray done. So this was done from Apurva Diagnostics, which is one of the best clinic in South India. And further, when I got to know that I had something going wrong on my right side, then I decided to take an x-ray. So yes, this is my x-ray, and I know it's not very clear. I'll be showing you a closer view with a proper Google picture also. So I'll just show it to you. This is my x-ray. Okay, so yes, this is the right side, and I don't know if it's visible. Yes, I'll show it to you in a closer view. My tooth was literally dancing. The root which is there below the tooth, it was dancing. It was completely twisted, and what it does is it was affecting my other tooth, the next molar tooth. So I had experience in the suffering of the entire right side of my jaw. Okay, so yes, as I said in the beginning of the video, I have gone through it already before, like 2 years back, and I will show you the video. I'll show you the swelling, I'll show you the way my face was swollen, and it was like literally swinging down below. So here is one of the example as to how complicated a wisdom tooth can grow. You can see how it is grown completely under the skin. Thank God this was not my situation. The next example is actually slightly same to my situation. Yes, this is the one. It doesn't seem as complicated as compared to the previous picture, and it is almost same to my x-ray, because at least in my x-ray the tooth was shown above, but here yes, it is slightly below the skin. And this picture demonstrates the actual effect of not removing a wisdom tooth when it is causing you a hell lot of pain. So yes, what it does is it causes decay or a disease, or it causes damage to the next molar teeth that is right next to it. So this is my surgery procedure. Let me cut short into a very small clip. I haven't recorded any video because I wasn't allowed to. So let me just tell you in a very small sum up as to what transpired in my clinic, like in my surgery routine. So what exactly happened was, firstly, it's always advised not to go alone. Better take someone with you, because sometimes if the pain is unbearable, you won't even be able to drive back home. So yes, with me, my dad accompanied me to the clinic. So I had 3 people around me. One was a surgeon, one was a dentist, and one was a nurse. So the dentist, I have been known to him like for at least past 6-7 years, and he's really good, and his clinic is right opposite to Alsur police station. And yes, the surgeon was the same person who operated on my left wisdom tooth also. That was 2 years back. So basically, first what happens is they inject at least, I don't know how many ml of anesthesia into your cheek, that is inner cheek. And then in case if he finds there is a lot of inflammation on your, maybe like a swelling or something, what he does is he injects on the swelling also. I know it was very raw to even imagine, like I cannot imagine, because it was really terrifying. I was already undergoing a lot of pain, and on top of that, when he injected something right on the swelling, I panicked and I made a huge noise. There were patients outside waiting in the clinic, and they also got panicked. Obviously, when they also come up with some surgery or something, they know it's gonna pain. They also know it's very basic human nature. So yes, I panicked, I shouted, and they were like, it's done, okay, cool down and all. I was like, okay, please. Okay. So yes, once the anesthesia is done, the entire jaw, including my lips, everything becomes numb. Okay, you just can't feel anything. But I think it was a local anesthesia or something, I'm not sure, because in spite of waiting for 15-20 minutes, I could still feel my touch. I could still feel that there's something which I can still, express. Like I can still feel that there is something in there, the pain or whatever it is. But still I was like, no, it's okay. I can do it because I've already have an experience. So yes, I went after 20 minutes, and 3 people were surrounding me, and one was to hold my hand, one was to open my, jaw, and the nurse was giving the suction. So as per my knowledge, the tools that was kept in front of me was the suction machine. That is obviously when they cut out your skin, the blood comes out, and they need a tube. They have a tube type of machine or something which they suck out the blood with, or maybe my saliva or something like that. So they suck out that with, and they have a small mirror type some stick, I don't know, some metal stick or something, where they can see as to is there any damage on my upper jaw or something. That was kept. There was a few other dentist related tools, just like a small metal sticks or something that is used to expand my cheeks as much as possible, which is kind of soft. It's okay. And yes, there was a sharp objects, like for example there was scissor, there was thread, there was knife and all these things, which is usually kept to cut out your skin and all. And interestingly, there was a small metal hammer also, because last time what happened was my tooth was really strong and it was very hard to pluck it out. So they started hitting it. That is, they need to break the tooth into 2 different parts, and that's how it comes out. So yes, this time they didn't use the hammer, but I saw its presence right in front of me. So what I was supposed to do is I had to lie down, and there was light in front of my face, and yes, I cannot open my eyes after that. So what he did was, and yes, there was another machine, interesting one also, which is a vibrator, like a tube type vibration or something, which is nothing but it's a sharp object which is used to drill off your teeth. In case if it's, obviously you cannot break out the whole teeth with a hammer or something, you're supposed to cut it out, like shave it out into half. So yes, that's what it is done. So I lied down, and then I got to know, firstly what the surgeon asks is, he makes a cut and he asks me in case if I'm experiencing any pain. I said him no, I was fine. But later, literally I was wrong. I was wrong because I could feel the pain in spite of anesthesia injection. So yes, what he did was, with that vibrator shaving off machine, I don't know what it's procedurally called as. So yes, he shaved, he first ripped off my skin, and then I could feel the skin, like a slight tear or something. Then later what he does was, he started expanding my cheek as much as possible. It was like a rubber band. The much you expand, the much it's easier for him to look out as to what exactly is happening there. And this nurse was like, she was giving like suction and suction and suction, like plucking out all the saliva and the blood stains, etc. And the dentist was right in front of me, who was holding my hand. I was like, stop, please, it's paining and all. So yes, the entire procedure took for approximately around half an hour or something. And I could hear the surgeon saying that, oh God, your tooth has grown very complicated in nature. It is not proper at all. The tooth, like as I showed you in the video, it is completely twisted. So how can we, like, it's really scary, because the more they drill the skin in, there are chances of nerve damage or vein breakage. So in case you experience a nerve damage, that will lead to much more complications, which will lead to another surgery, and you just can't imagine. So yes, I could hear the surgeon and as well as the dentist discussing, like, let's not dig it up more. We have digged up like sufficient enough. Whatever parts was broken, let's just take it off. So the vibration machine or something, the more they were drilling, the more it was paining. I could feel they are going inner and inner in depth of my jaw. I could feel the entire half of my neck vibrating. So when I said yes, I am able to experience the pain, he did give me another 2 doses of anesthesia, which I didn't experience any pain at that time while injecting the anesthesia, but still it was of no use. And yes, they were complaining that it was some local anesthesia or something. And it's like, I don't mind what anesthesia it is unless I don't have to face any pain during my entire surgical process. So yes, this is how it went. And finally, when I could hear that, get me the stitches, get me the threads, let me stitch it out, I was in a sigh of release. I was like, yes, finally it's done. So yes, they finally stitched the skin off and all these things. And they were like, okay, they gave me the prescriptions, they gave me the tablets, they asked me to eat like tons of ice creams, etc. And yes, having a lot of ice creams and chocolates in the entire process, like cold items, caused me a lot of acne and pimples and all the sufferings that I could bear in my entire lifetime for past 24 years. So yes, this was done. And finally, when I came out, you should have seen my face that was completely, twisted to the right side, because he was expanding my cheeks like so much with my lips, etc. My face was completely, I was like, it was like that. So, and I forgot to wear mask before coming out, and all were staring at me, like all the patients were staring at me. I was like, I don't mind, I just have to go home, take the painkillers and sleep off. Yes, this was the first video that I recorded once I reached back home after the surgery. There was slight swelling on my right cheeks. One reason was there was cotton inserted, inside. So that is why. And since I started experiencing pain within 1 hour or 1 to 2 hours after I came back home, I started taking my painkillers, which I felt really difficult to swallow too. And these are the medicines, the medications that I had to undergo, which I'll be explaining at the end of the video as to what are its uses for. It was really difficult for me to lie down on my right side, like very much. And this was the next day when I had to just go and need a checkup from the dentist. And here is my brother who was accompanying me as to order something to eat because I was really starving. I couldn't swallow anything. And finally, with lot of courage, I ordered some samosas from a samosa party, and in spite of it being very difficult to swallow, yes, I did it. And what I was supposed to do was I had to take a lot of liquid intakes, but in turn I started taking soups. These are some Chinese mancho soups, etc. And this is my face the next day evening. You can see slight swelling. This was for my dinner. In spite of I was recommended to take solid foods also, but very soft ones. So this was my dosa. And the next day night, before sleeping, I recorded this video to show you how it looked. You can see the swelling on my right side, and it was very difficult to wash my face also, so I used to take some wet tissues and wipe it off, wipe all my tensions off the face. And this is the closer view. Please ignore my awkward looking face. So yeah, you can see the sharp curve on my right jaw, and see my jawline on the left and see the right one. There's a lot of difference. It's okay, it happens. Shit happens. And this was the next day morning after I got up. It was very difficult to open my mouth. And yes, you can see me comparing my jawlines to my left and then to my right. You can see that there was a slight swelling also on my neck. And see, this is how much I could open my mouth. Even one finger couldn't insert. It was really difficult for me to open my mouth. And that day evening, after so much of struggle, I tried to wash my face off, do some goggling with salt water, etc. Keep some ice packs and all. This was the third day, and yes, it was okay, manageable. It was bearable. So I started eating some idli, again solid food, and you can see how difficult it is for me to swallow just a small piece of idli. Yes, I am swallowing. I am, yes, did it. And this was the next day. I think this was the 4th or 5th day when I had to get ready to prepare myself for the seminar at my workplace, and yes, I was looking pretty cool. And once I'd work, since it was work from home, I started taking my ice pack side by side. And whatever it is, no matter what, my cravings for momos doesn't decrease. I started ordering some chicken momos from Wow Momos, my favorite place, and in spite of not able to swallow, I did it. This didn't resist me, this didn't stop me. And yes, you can see the swelling is almost reduced. And now look at the circus I do just to swallow a small piece of momos. In spite of very difficult to chew, I'm taking the risk because my love for momos doesn't reduce no matter what. So yeah, here I show you an alternative. So what I do instead of brushing, that is use another mouthwash that is called as Listerine Cool Mint, that helps to prevent gum problems, bad breath and plaque. So what I do is I goggle just one cap of the solutions for at least 30 seconds that I show you here, and then spit it out. Now what I'm going to explain you is my medications. So here I have like all my finished medication, all my finished tablets, which I preserve to show it to you. So yes, this one, the first one is amoxicillin. Okay, so this was used like twice in a day, that is after breakfast and dinner. And why it is used is for reduction of bacteria, that is to reduce wide ranges of bacteria that is grown after a surgery is done. So this is it. And later, next is Trypsin Cryptotrypsin. Okay, I know I might be wrong in pronouncing it, so please adjust with it. So yes, this was taken again twice a day for maybe 5 days or something. So again, this was also after breakfast and dinner. And why this is done is, actually before I would take up this one is an antibiotic and this one is an enzyme. So what it does is it breaks down the protein intake from the food and it turns them into amino acids. So amino acids is usually too good for building up muscular growth or your broken tissues or your broken vein or something like that, and it also is good in promoting hormones, etc. So this one. Next one is Combiflam, and it's very common, all of you know it's a painkiller. So yes, I was recommended to be taken like at least 3 to 4 times in a day, but I try to bear the pain because it is also suggested not to keep taking painkillers. Try to bear the pain as much as possible. So finally, I kind of continuously took it for maybe 1.5 weeks and then I stopped it. Next one is Ranitidine. So Ranitidine is, it is sold under the manufacturer name known as Zantac or Zantac, etc. So yes, what this one does is to reduce the stomach acid. So nothing but, usually your mouth is prone to ulcers, etc. So when I already have this pain going through, if it is one of the reason why I come out with an ulcer, that will be another pain. So yes, this one helped me to reduce the ulcers in my mouth as well as stomach acid. And then the final one, yes, this was also taken I think twice a day, yes, again after breakfast and dinner. And this one is Neurobion Forte and it looks like this, which I have been still consuming, and this was recommended for 30 days. And why it is done is nothing but to treat my vitamin B deficiencies as well as to treat nerve systems as well as for healthy promotion of nerve system and immune system. So yes, I hope you enjoyed my awkward face throughout the clips. So yes guys, so this was my entire 2 weeks postpartum removal of wisdom tooth, and this is how it went. I haven't still removed my stitches. The dentist called me to, but I'm really scared to go out to him because the last time when I went, that was last week or something, because he asked me to come and I couldn't open my mouth I could just open my mouth only this much, and what he did was he was like, it's going, and he just removed it like so much, and I again panicked and shouted, I don't want that awkward scene again. I'm trying to do some jaw exercises, some mouth exercises so that I can open it as much as possible and then go out to him if my if my stitches aren't automatically coming out, etc. Because last time my stitches did fall off on its own, but this time it's not happening. It's giving me a lot of trouble. I just hope for the best, and I hope it's not repeated again in my lifetime. So yes, I hope you all enjoyed this video. Until next time, hope things get better. I hope you all are doing good out there. Take care and see you next time. Bye bye.